Hello YouTube viewers, it's me again. I just want to give you an update on my breast cancer journey. So 3 weeks ago, sorry, 3 days ago, I did my first chemotherapy. I received 4 types of treatments. Carboplatin, taxol, perjeta, and herseptin. And then I have other medications, pre-meds before I started with the chemotherapy. I got Decadron, Zofran, Benadryl, Tylenol, and then I had to continue the Decadron and the Zofran once I got back home. During chemotherapy, I tolerated the treatment. And I didn't have any issue as far as nausea and vomiting or any reactions. Um, so I sat there for 5 hours and then went home. I felt fine. The following day, though, and today, um, I really felt crappy. The day after, I started having some chills, although I didn't have any fever, and had some constipation issues. I guess it's the high dose of Zofran that I get. I'm a nurse, and usually we just give Zofran at 4 milligrams at the most, 4 to 8 milligrams. But I guess if you're a chemotherapy patient, you get more. So I get Zofran, 16 milligrams Zofran every 8 hours for 48 hours, beginning chemotherapy, every 8 hours. So I really suffered from a really bad constipation, and then I guess the other chemotherapy agents make you constipated. So I had to take a lot of stool softeners, and that made me really crampy all day. But finally, when I was able to go to the bathroom, I felt relief. I felt a bit fatigued as well because I guess the Decadron, which is a steroid, so that you won't have any reactions to the treatment, produces that side effect. So I'm kind of fatigued because of that, I guess. Although I move around, I go up and down the stairs. I have a 2-story home. Go out to eat and do a little shopping. Yeah, the only thing, I think the nice thing about with this treatment is my eating habit has not really been affected. I've still been able to eat good. I tolerate food. I have appetite. Towards the evening last night, I started having achy joints. I guess that's the side effect from perjeta. So I'm not really sure. I can't remember all the details that we were told during the chemo class, but that's what I can remember. So I have achy joints, and up to now I have achy joints. My knees are aching, and my hips are aching. I walk like an old lady. And then tonight, beginning tonight, I'm starting to have some throat pain. I don't really see any oral thrush, but I feel like I have I don't know, like some kind of tonsillitis, or just a throat pain. I just have that throat pain. But yeah, I've been able to eat though. Really, drinking, eating has have not been affected from any of the symptoms that I'm having, but I just feel crappy. Um, you know, since the day after chemotherapy, and today is the second day. That's my update. And then as far as my breast surgery, pain wise, I still have a lot of pain. I've started doing more of the recommended exercises, although we're supposed to do it 5 times a day, but I don't really get to do that religiously. I've only done it twice, I guess, today. Um, my range of motion starting to get better on the affected extremity. Um, tissue breast expansion. So since I've started chemotherapy, I cannot go every week anymore for breast tissue expansion. So I'll go visit my plastic surgeon once every 3 weeks, at least a day before or on the day of my chemotherapy, which is the expected day that I am healthy. With chemotherapy, you your immune system goes down, because you don't only cause damage to the cancer cells, but you also cause damage to the good cells, such as your blood count or blood cells. So your white count goes down, and that makes you prone to infection. So we're not doing anything invasive, or putting in saline into my breast tissue expander until we know I'm healthy. So I need to go into the lab every at least 2 days before my scheduled chemotherapy to monitor my blood count. Prior to chemotherapy, I also did a MAGA scan. It's a heart scan to check for your heart function. So it measures the ejection fraction. One of the treatments, I can't remember which one is that, but it can cause damage to the heart. So um, they need to monitor my heart closely. So I need to do that test every 3 months. So that's pretty much it as far as my treatment is concerned, and all these annoying side effects that I have. So that's all. I hope you learned something from what I've shared tonight. Thank you so much, YouTube viewers.